If you're a woman dealing with PCOS or polycystic ovarian syndrome and you're trying to learn how to manage or regulate your menstrual cycles or even trying to conceive, then this video is definitely for you. In this video, we will discuss what PCOS is, what signs and symptoms it frequently presents with and how it is diagnosed, some of the disease processes complicated or even initiated by PCOS, and some ways that you can manage it. So without further ado, let's get right into it. So what exactly is PCOS? In a nutshell, it is a hormonal imbalance in the female body. The disease is known as polycystic ovarian syndrome, but not every female will present with cysts on her ovaries. Why it occurs is not clearly known, but what is known is that in the female body, estrogen is the dominant hormone, and in the male body, testosterone is the dominant hormone. However, due to an unknown pathway, the male hormones tends to uptick in the female body, causing a dysregulation, and that leads to all of the signs and symptoms that a woman may encounter in her body. So what are some signs of PCOS? Before we list the signs and symptoms here, it is very important to state that some of these will also present with other disease processes. Do not use this video to diagnose yourself. Instead, work with a medical provider who can conduct the necessary tests and examinations on your presenting condition and reach a differential diagnosis that addresses whatever you are facing in your body. Some of the signs and symptoms of PCOS include irregular or missed menstrual cycles. Some women will experience weight gain or difficulty losing weight. Some of them will have hair growth in unfavorable parts of their body or even experience hair loss on the top of their head. Some may deal with depression and others may deal with insomnia. Along with the signs and symptoms listed here, PCOS is also known as a precursor for diabetes in the female body. Once the hormones become dysregulated and those androgen or male hormones start to tick up, it causes insulin resistance in the female body. And when your body is not using insulin correctly, your blood sugar tends to tick up, and a lot of signs and symptoms such as end organ damage or high blood pressure, anything that increased blood sugar causes in the body becomes a real nightmare that the female body has to learn to manage. So what can be done about it? I'm glad you asked. Let's talk about it. Unfortunately, there is no known cure for PCOS at present time. However, it can be managed. There is a multifaceted approach to effectively managing it depending on the severity of its manifestations. Some of the things that you can do include eating a low glycemic diet. That means eating your dark leafy vegetables, avoiding carbohydrates that are simple or foods that are very high carb. You want to make sure that you are eating foods that are high in fiber and rich in omega-3s. Make sure you are staying sufficiently hydrated and avoid eating late at night because that can cause an imbalance in your ghrelin hormone, and if that gets out of balance, it can cause further sequelae that are not in your favor. Other things you want to do is make sure that you are getting sufficient sleep. Aim for 7 to 8 hours a night. You want to make sure you are staying sufficiently physically active. The current recommendation is 150 minutes per week. Break that up however it suits your need, but make sure that you are getting exercise, and as with anything else, the more you can do, the better. Try to also limit the amount of calories that you are taking in. That will help with weight loss or weight maintenance and avoid weight gain. You also want to limit the amount of stress that your body is dealing with. Now, there are different types of stress. Exercise is considered stress in the body, but it is a eustress, a good stress. The types of stress we are telling you to limit here are what we know as distresses. Distresses are things that come to disrupt your body's hormonal balance, causing your cortisol to shoot through the roof and further complicate that insulin resistance and high blood sugar in your body. It is very important to diagnose and treat PCOS early in the process so that menstrual cycles can be better regulated and increase the chances of pregnancy. Now, keep in mind that if a woman becomes pregnant and she is dealing with PCOS, there is a higher likelihood that she will have gestational diabetes mellitus, 2 to 3 times higher than in the average female without PCOS. It is so very important to deal with it before pregnancy and during pregnancy because it can cause a lot of unfavorable outcomes for both mom and baby. If you deal with any of the signs and symptoms mentioned here, make sure you link up with your healthcare provider so that you can be quickly diagnosed, quickly managed, and live your best life. Make sure you follow Nurse Sonia for more helpful maternity, postpartum, and childcare tips.